Welcome back to the second part of Lesson 4. In this lesson, you will learn about Mrs. Johnson's experiences. It provides you with an opportunity to learn and reflect on how to provide comprehensive care. Let's meet Mrs. Johnson. Mrs. Johnson is 83 years old. She is married and has 3 children and 7 grandchildren. She was diagnosed with Parkinson's disease 7 years ago. In addition, Mrs. Johnson has diabetes mellitus type 2, for which she uses insulin injected by the home care. Before she was married, she worked as a maternity nurse and she quit working when her daughter was born. When her youngest son started going to primary school, she started working in a clothing store until she was 62 years old. Mrs. Johnson had an active social life in her village and the church community. She likes to cycle, however Parkinson's disease has made this troublesome. She lost her balance quickly and participating in traffic became difficult. Over the last period, Mrs. Johnson has lost approximately 6 kilograms in 2 months and she also chokes on a regular basis. 8 months ago, she was admitted to the hospital due to pneumonia. Afterwards, her condition worsened, she suffered from hallucinations and her husband has indicated that caring for her is becoming harder. He is staying home more and more to look after his wife, despite his own health problems. A common symptom in Parkinson's disease is communication problems. During a consultation with the Parkinson's disease nurse, Mrs. Johnson indicates that she is having difficulties with speaking. She is having problems to find the right words, and to clarify herself, during conversations with others. The meeting with the Parkinson's disease nurse was brief. In the palliative phase you should take into account that the patient is having a limited concentration and attention. A 10 to 15-minute conversation can be experienced as intensive. A speech and language therapist can support patients with Parkinson's disease in oral motor problems. These oral motor problems can be divided into 3 categories: difficulty with speech, swallowing problems and drooling. For example, a speech-language therapist helps to reduce soft and inner speaking of patients by practicing to speak louder. Intensive practice with the correct guidance of the speech therapist ensures greater movements in breathing, vocal cords and articulation muscles. Other problems such as choking, eating slowly and swallowing too late, and drooling, can be treated well within short practice periods with the speech therapist. Indications for referral to a speech and language therapist include the presence of limitations in speech or communication. Moreover, the presence of limitations in swallowing, with drooling as a possible result, or problems with eating or drinking due to dysphagia, with aspiration pneumonia or weight loss as a possible result. Finally, the need for advice and the use of aids to facilitate communication is an indication. After the previous consultation with the Parkinson's disease nurse, she noticed that Mr. Johnson is showing signs of caregiver burden. The Parkinson's disease nurse invited him to come to a consultation alone, because she wants to talk about his experiences in taking care of his wife. He is saying that he is doing a lot for her, like helping her with to get dressed in the morning, giving her medications, and cooking her meals. Yet, this is not what he is struggling with at the moment. Mr. Johnson indicates that he has the feeling that he lost his wife already, since she is becoming another person in his eyes. After the conversation, the Parkinson's disease nurse decided to refer him to a psychologist to talk about his feelings of loss. In this stage, the caregiver grieves about the loss of the health of their loved one, personality changes and the relationship they had together. Through tests, observations and personal conversations with the patient and their partner, a psychologist can help to clarify the occurrence of psychological problems, and provide support in the grieving process, behavioral changes and belonging feelings. The neuropsychological treatment may be complemented with cognitive rehabilitation programs, which will help the patient in learning to deal with limited cognitive possibilities in daily life. Additionally, a psychologist may offer the patient and their partner psychotherapy, to assist in acceptance of the disease and to improve the quality of life. All healthcare professionals should provide bereavement support. This can be as simple as listening to the story of the caregiver. Additionally, psychologists may offer psychological consultation and psychotherapy. Some patients find relief in talking to a spiritual counselor. Mrs. Johnson noticed that her situation is getting worse. She is afraid that she will be unable to go to church or to talk with her family, as her speech is getting softer and it is more difficult to tell a story. She is having a lot of questions on how the disease will progress and about end-of-life decisions. She discussed these issues with the Parkinson's disease nurse, and the nurse referred her to a spiritual counselor. Patients may experience different spiritual needs, such as existential challenges, like the purpose of life, identity, hope, and meaning of life, value-based considerations and attitudes, like peace, reunification with others, prayer, ethics and morals, relationships, forgiveness and closing, and, finally, religious needs, like religious literature, beliefs, conversation about God, and eternal life. All healthcare professionals can support the patient and their family or caregiver in their needs of spiritual care by listening, supporting, recognizing, guiding and treating. However, when they feel their experience is limited, they can refer to a spiritual counselor, such as a faith leader or a healthcare chaplain, in consultation with the patient. Practical implications for healthcare professionals could be: suggest group support, monitor the changes of the patient in their needs of spiritual care, prevent isolation and demonstrate belonging, discuss what to expect, and determine unmet needs, preferences and wishes. In this video, a professor from Radboud University Medical Center, who has expertise in palliative care, talks about the role of a spiritual counselor. Please note that this is how the role of the spiritual counselor is exercised in the Netherlands. The role varies per country. Another problem of Mrs. Johnson is weight loss. She has experienced unintentional weight loss, swallowing problems, choking, and she recently suffered from a pneumonia. Furthermore, Mrs. Johnson has difficulties cleaning her teeth. She started eating softer food because chewing has been more difficult and meals take twice as long. Mrs. Johnson is following an inadequate, low-calorie diet, and is in a poor nutritional state. Mr. Johnson discussed his observations with the Parkinson's disease nurse. She referred Mrs. Johnson to a dietitian. Patients with Parkinson's disease can experience a wide variety of problems related to diet, such as unintentional weight loss or malnutrition, constipation, medication intake and response fluctuations in relation to food, unwanted weight gain, chewing and swallowing difficulties, slowed gastric emptying, orthostatic hypotension, and vitamin and mineral deficiencies. Tasks of the dietitian depend on the person's needs. They include asking about the dietary intake and habits and translate these into a suitable diet. If constipation problems occur, the fiber and fluid intake need to be taken into account. When the patient has experienced unintended weight loss, the amount of protein and energy in the diet is important. If someone has swallowing problems, the dietitian may advise to consume soft foods. Furthermore, the dietitian will advise the patient to eat in an environment where he or she is not easily distracted, and will advise to not speak while eating to avoid choking. Back to Mrs. Johnson. A few months later, the condition of Mrs. Johnson is getting worse. During the day she is very tired and not interested in the world around her. Her stiffness is worsening, which makes taking care of her very difficult. Her husband is worried, because she is not eating and not taking her medicines. Mr. Johnson contacted the home care nurse and she called the general practitioner to discuss the situation. The general practitioner has planned a home visit to assess the situation. He suspects pneumonia and proposes to send Mrs. Johnson to the hospital for further treatment in the neurology department. When the general practitioner asks if Mrs. Johnson agrees to be sent to the hospital, she nods yes. However, Mr. Johnson indicates that after her last admission she mentioned not to be admitted to the hospital again. This is not discussed or recorded in the medical file of the general practitioner. Although they are trying to figure out what Mrs. Johnson wants, there is no sufficient insight into her wishes. In addition, the general practitioner is aware of the fact that some patients adjust their treatment wishes over time and under different circumstances. Eventually, the home care nurse, general practitioner and family decide to send her to the hospital. Mrs. Johnson ends up in the neurology department to treat her pneumonia, and unfortunately she develops delirium during the hospital admission. After a week Mrs. Johnson's situation is getting worse and she refuses to eat or drink and to take her medicines. A nasal tube is being considered, however, the family indicates that this is not one of Mrs. Johnson's wishes anymore. After a few days Mrs. Johnson passes away in the presence of her husband and family. After 4 months Mr. Johnson is talking with the nurse who took care of his wife about the periods after she passed away and the last weeks of her life. Mr. Johnson indicates that he had doubts about her admission to the hospital, and the family preferred to let her die at home, like she wished. However, due to the situation and failure to record treatment wishes, Mrs. Johnson passed away in the hospital. Click on the video link in the slide to get more information about aftercare for informal caregivers. An important task of healthcare professionals, for example the Parkinson's nurse, is to introduce the discussion about future wishes of the patient and their family. It is essential to start talking about this before the patient is in an advanced stage of the disease and the capacity to talk about this is decreased. The process of talking about goals, wishes and preferences with regard to future care and treatment is also called advanced care planning, ACP. These topics will be explained in depth in Lesson 7. Specific attention also should be paid to legal issues. Important topics to discuss are: will. Everyone aged 18 or over can, and should, make a will to ensure that when they die their property is distributed exactly as they would wish. Enduring power of attorney. If a person anticipates that they will become unable to manage his or her legal and financial affairs, he or she may need to appoint someone he or she trusts to act on his or her behalf. Advance care directives, sometimes called living wills. These allow the person to give instructions about medical treatments that he or she does or doesn't want if he or she becomes terminally ill and is unable to express his/her wishes. Communication is essential in collaboration of professionals and also essential to avoid problems. Problems can arise in situations in which patients and caregivers receive conflicting information or in situations in which patient and caregivers have to repeat information several times. Patient and caregivers having anxiety and confusion over who to contact if a particular problem arises or poor communication resulting in inappropriate hospital admissions, should also be avoided. Care coordination should be performed by a healthcare professional who is easily available, and who has short lines with the other healthcare professionals involved and the person with Parkinson's disease. Think about, for example, the Parkinson's disease nurse or the general practitioner. The care coordinator should perform the following tasks. 1. Assessment for care needs for patients and family, respectively caregivers. 2. Developing a patient-centered plan. 3. Navigation and monitoring. 4. Collaboration with other healthcare professionals. 5. Advocacy. Essential in the interdisciplinary approach is that patient's individual care plan should be based on the individual care needs and preferences of the patient and his or her caregiver by involving them in shared decision-making and increasing their self-management. An individual care plan created in this way positively influences self-efficacy, quality of life, treatment compliance and patient satisfaction. Advanced care planning is used to talk about future wishes and needs of the person with Parkinson's disease and his or her caregiver and is improving the communication between the healthcare professionals and the patient and caregiver. In a project in the Netherlands we composed the Parkinson Support Workbook, which is used in regular conversations between the patient and caregiver by a nurse trained in palliative care for people with Parkinson's disease. This workbook can support in the development of the individual care plan of the person with Parkinson's disease. After all, with the use of this workbook and the regular conversations with the nurse trained in palliative care for people with Parkinson's disease, Mrs. Johnson decides which healthcare professionals have to be contacted for optimal care, and she also decides which advanced care planning decisions will be documented. Important to know for Mrs. Johnson is that if she changes her opinion with regard to the ACP subjects and decisions over time, she always can make adjustments. Crucial is that her care is organized around the topics which make her life worthwhile, and this might change over time and as her disease progresses. By now, you have learned more about the multidisciplinary care approach in the case of Mrs. Johnson. We will conclude this part with a take-home message. In the care for people with Parkinson's disease, healthcare professionals should be aware of the expertise of other professionals, and contact them when their own experience is limited. Thus, the individual needs of the patient and caregiver should be the starting point in their care.